Well, as the country adapts to the wave of newly insured patients under the Affordable Care Act, there have been growing concerns about the shortage of doctors. But changes in healthcare law also driving a rise in the popularity of what's known as concierge medicine here in the U.S. But what exactly is it? Sharon Epperson reports.
The athlete, good work.
Dave Kirpin stays on the go, running a company that helps small businesses manage their social media presence.
Literally every minute is booked from morning until night. And I use my calendar to track single thing that I do, and I really take advantage of every minute.
The busy CEO doesn't like to complicate his schedule or waste time, especially when it comes to his health.
You go to the doctor every 6 months, you wait in an office, you get seen by one of a dozen or 24 doctors that happen to work at that office and have you for the day. You wait in the waiting room, then you wait in the doctor's office, then you wait for billing. It takes a long, long time.
Kirpin is one of a growing number of consumers who want to be able to see a doctor on demand. So he hired Dr. Ken Redcross. He's a concierge doctor, a primary care physician who offers a greater degree of personalized attention than a traditional doctor for a fee.
You got a busy executive, can't get out, thinks that he has to work 25 hours a day. What am I going to do if I'm sick and down? Well, here comes me.
There are more than 4,000 concierge doctors in the United States today, according to the American Academy of Private Physicians. And that number is only expected to grow in this era of healthcare reform as more Americans seek alternatives to the way doctors deliver care. Concierge doctors charge a retainer that can range from $1,500 to several $1,000s a year.
Hey, how are you?
That gives the patient 24/7 access by mobile phone, email, or text, and the ability to make appointments the same day. Some docs write out prescriptions and may have them delivered to your home, and some may even make house calls or office calls.
It really runs the gamut. Sometimes patients will call for a pesky cold, cough, flu-like symptoms that haven't gone away. Some patients will call because they're like, Doc, I'm a little short of breath and I don't really know what's going on. Am I anxious? Am I having an issue with my heart? Am I having an issue with my lungs? Patients will also call because they have diabetes and they haven't had a follow-up. I'll set up a way for them to get blood draws at their office if they're too busy to come out to the lab.
Kirpin, a patient of Dr. Redcross, pays a $2,500 annual retainer.
I call him every 6 months or I text him. He's over the next day or 2 days later, comes to my office, comes to my house, waits for me, waits till I'm done with the meeting, and I can see him just like that.
He says the concierge services are worth the cost for his own health and the health of his company.
Just the time saved alone ends up being worth it because I can use that time to make money with our business.
For Nightly Business Report, I'm Sharon Epperson.